Okay, good morning. Um, this morning's speech is in regards to complications in the female body, but in regards to the fallopian tube. And I chose to discuss this because I had complications or things going on around my female organs that I was not aware of that led to me having complications and eventually emergency surgery. And some things that will cause complications in regards to things happening in your fallopian tube as far as a utopic pregnancy is endometriosis. And endometriosis is inflammation of the surrounding tissues of your organs, your female organs. So it could be around your ovaries, around the fallopian tube, and it can also be in your uterus where you have inflamed tissue. It can lead to ovarian cancer, utopic pregnancies, of course, not having the egg released because of the seriousness of the inflammation, where eggs won't even make it into the uterus and won't be fertilized. So you can either get a utopic pregnancy or your eggs won't even be able to be fertilized. And it can also make you not necessarily sterile, but you won't be producing mature enough eggs to produce life. It can lead to fibroids because you will can have heavy menstrual cycles. And as far as heavy menstrual cycles, your flow is really heavy, it lasts long, and you're bleeding, having a lot of pain. So in regards to the endometriosis part, it can lead to having like pelvic infection just because of the inflamed tissue and scar tissue. And that forms around your reproductive organs, causing them to bind to abnormal walls or other organs and increase the risk for the utopic pregnancy. If a fallopian tube is damaged or blocked, the odds of conception are decreased significantly. Partially blocked tubes may also increase the risk of the utopic pregnancy. To determine whether or not you have this damage or concern in that area that a tube is blocked, a doctor will need to do a laparoscopic procedure. And a laparoscopic procedure is where they sedate you. You will have to be fully sedated. They make an incision through your belly button. At least this is what happened to me, and this is also from my research what they do. They make an incision through your belly button and they look through a microscope. And if they do have to do any kind of procedure, they will cut left and right of you on your abdomen, so left and right of your navel, and they will go in with the instruments, and the other side will be where they will remove anything or fix anything. But one side's for the instrument and one is like an entry and exit port of whatever they're going to do inside your body. It's called a laparoscopic procedure or a hysteropirogram. Don't really know how to say that, but that means they insert dye through a catheter just to see, what's going on, what's abnormal or inflamed. They also can do it through the cervix into the uterus, where they can see the lining of your endometrium to see the severity of that through your uterus. X-ray are also taken to see if the blockage or dye will flow to the abdomen. And also this can cause internal bleeding. It's called pelvic free fluid. And pelvic free fluid is just blood outside of the normal areas, right? In some cases, you are able to fix this damage or blockage. It can be reversed, but reversing it can lead to more complications just because, you have to think of a fallopian tube being kind of as tiny as like an angel hair spaghetti. It's not very big, so just fixing something that tiny is very risky in itself. So they do prefer to just remove it if it is complications, because if there is a rupture of a utopic pregnancy or a cyst forming in your fallopian tube and you hemorrhaging internally, you know, the livelihood of you is very risky. It's very high. It is very serious. Internal bleeding is very serious. And it is very vital. You can die. So in regards to reversing it, the tube litigation is what it's called, or repair of the portion that's damaged of the fallopian tube. So the blocked portion is removed and two healthy ends are joined together. If they are able to do that, in my case, I wasn't given that option. So it originally started where the cyst or sac, it wasn't really named right because my pregnancy test wasn't really positive, but my blood levels were positive. So they were going based off of ultrasound. And with ultrasound findings, one day it was like 3 millimeters, and then I had severe pain while I was at work. And when I went, it was like 4.2 millimeters. I'm sorry, I said centimeters, millimeters. And everything was okay because the doctor said that my numbers were going back down. So it was like, okay, it's going to dissolve. Sometimes that happens. And then I had really bad pain again. And I also went to do blood work again after I left the hospital. About 2 days later, I was due to do blood work again because they were monitoring my HCG levels. And it shot back up like 500 points. And the doctor called me and I had to have emergency surgery. And when I went into her office to be examined, it went to 5.6. So I'm so thankful that I went in, regardless that I was so scared to have surgery. Like, oh my gosh, I've never been sedated in my life or have had to have surgery. I was even going to be a surrogate, so I've never had any female complications. So this was pretty scary. I wasn't able to have my tube repaired or fixed. I was also bleeding internally, so I don't think that was my option. It wasn't even discussed. But they put two healthy ends together, and a natural treatment to help your body heal will be vitamin C, turmeric, ginger, vaginal steaming. At least this is what the internet says. You know how Google can be, right? Tubes do grow back together, or a new passage forms. So when you have your tube removed, a new passage is formed. So you are able to get pregnant. But once you have two tubes that are removed, you are considered sterile at that point, even though you may be producing eggs in your ovaries, but you will not be able to become pregnant. But it's called recanalization when a new passage forms from where the tube was removed, and it allows the eggs to be fertilized by the sperm. So you are still able to have the same probability of getting pregnant that you had before the tube was removed. So removal of the tube does not make you fertile, but if you remove both of them, you will be considered non-fertile, excuse me. So I just wanted to shed some light on complications. It is serious when it comes to abnormalities in the female genitalia area internally. And it is something that does happen more than not. And just, if you have any kind of complications, go to the doctor. Don't be afraid. Because I went a couple of weeks before I actually went to the doctor, because I thought, maybe I was having like a UTI or something, or just, pain in my side. I didn't really think like, oh my gosh, I'm pregnant, because I was on birth control. And one day at work, I just had a lot of pain, and he sent me for an ultrasound. My doctor, I was actually working with my primary care physician that day. And he sent me to get an ultrasound, and they saw that I was internally bleeding and that I had a utopic pregnancy. And they wanted to just monitor it, but I just had a case where it was causing me a lot of pain, and they wanted to do preventative measures. I received a medication that was supposed to shrink it. I received 2 doses, 2 weeks apart, and it didn't resolve. It didn't resolve what was going on, and I ended up having to have emergency surgery because it was continuing to grow. So just as a female, stay on top of your health. Any little thing matters and could possibly help in preventing further complications.